Have you ever felt a nagging ache in your ribs that you just brushed off as a sign of getting older, or maybe a pulled muscle from a bit of gardening? What if I told you that for many people who are eventually diagnosed with lung cancer, that very same ache was the early warning sign they simply did not know how to read? What if that tiny, annoying discomfort was actually your body trying to save your life by whispering a secret before it had to scream? Today, we are going to talk about something that might feel a little uncomfortable but is absolutely vital for your future. We are going to uncover the specific chest pain pattern that many lung cancer patients miss until it is much later than it should be. It is so easy to tell ourselves that we are just slowing down or that our joints are acting up again, but sometimes it is not just aging. There is often a hidden culprit behind that persistent discomfort that almost everyone thinks is harmless, but I want you to know right now that growing older does not mean giving up, and it certainly does not mean living in fear of your own body. It means using smarter strategies and being a bit more observant than we used to be. It is never too late to make a change or to take a proactive step for your health. And by the end of this video, you will know exactly what to look for and how to tell the difference between a simple muscle strain and something that requires a real conversation with your doctor. You will feel empowered and informed rather than anxious because knowledge is the best tool we have for staying independent and strong before we jump into these life-saving details. If you care about staying healthy and independent well into your 80s and 90s, consider subscribing to our channel and turning on notifications because we share the kind of senior health tips that busy doctors often overlook in a short appointment. And let me ask you, where are you joining us from today? Are you watching from the United States or perhaps the United Kingdom, Canada, or somewhere else entirely? Please drop a comment below with your location because I am always curious to see how far our senior health community reaches, and it really helps us feel connected as we navigate these years together. Now, let us really get into the heart of the matter and talk about why this pain is so often misunderstood. The first thing we need to address is the nature of the pain itself because it is almost never what you see in the movies. When we think of chest pain, we usually imagine someone clutching their heart in a sudden, sharp moment of agony. But with lung cancer, the pain is often much more subtle and deceptive. Imagine a dull, heavy pressure that seems to settle deep within your chest wall. It is not always a sharp jab, but rather a persistent ache that feels like it is coming from the bones or the muscles rather than the lungs themselves. This happens because the lungs themselves actually have very few pain receptors. The real pain often starts when a growth begins to press against the lining of the lungs, which is called the pleura, or when it begins to affect the chest wall and the ribs. For someone over 60, this is so easy to mistake for simple arthritis or the lingering effects of a cold. You might find yourself thinking you just slept wrong or that you need a new mattress. But the key difference here is the consistency. If you notice an ache that does not shift when you change positions, or one that feels like a heavy weight sitting on your chest, even when you are resting, that is a signal your body is sending you. It is like a light on the dashboard of your car that flickers just enough to be noticed, but not enough to make you pull over. I want you to start paying attention to those flickers. Research published in various oncology journals suggests that nearly 25% of lung cancer patients experience this kind of chest pain as a primary symptom, but because it is so dull and nonspecific, many wait months before mentioning it to a professional. You do not have to be one of them, because catching this early can change everything. Moving on to another very specific part of this pattern, we have to talk about how your breathing affects the discomfort. Have you ever taken a deep breath to enjoy the fresh morning air and felt a sharp catch in your side or your chest? Or perhaps you have noticed that when you laugh at a joke or have a coughing fit, the pain intensifies for a moment and then settles back into that dull ache we just talked about. This is what doctors often call pleuritic pain. It happens because as you inhale and your lungs expand, they rub against that sensitive lining I mentioned earlier. If there is any inflammation or a growth in that area, the friction causes a spike in pain. Imagine a door hinge that is slightly out of alignment. It might stay quiet when the door is closed, but as soon as you try to swing it wide, it begins to creak and groan. Your chest is very similar. For many seniors, this is misdiagnosed as pleurisy, which is just an inflammation of the lining or even a minor case of pneumonia. But if that catch in your breath does not go away after a week or two of rest, it is time to look deeper. It is not about being a hypochondriac. It is about being an expert on your own body. You know your normal better than anyone else does. If your normal now includes a hesitation before you take a deep breath, that is a sign we need to take seriously. It might feel unsettling to learn this, but remember that catching this pattern now is an act of strength and self-care. Now, this next point is one that truly catches people off guard because the pain is not even in the chest at all. Many lung cancer patients report a persistent deep ache in their shoulder or even running down their arm. I know that sounds strange because we are talking about the lungs, but the human body is a complex web of interconnected nerves. There is a specific type of lung tumor often located at the very top of the lung that can press on the nerves leading to the shoulder and the arm. This is often called referred pain. Picture a garden hose with a kink in it. The water might stop flowing at the nozzle, but the problem is actually way back at the faucet. Your nerves work the same way. You might feel the pain in your shoulder blade or your upper back and spend months going to a physical therapist or using heating pads for what you think is a rotator cuff issue or a pinched nerve from age. David, a gentleman I spoke with, recently spent 6 months treating a sore shoulder with massage and ibuprofen, only to find out later that the real issue was in the apex of his lung. He told me he wished he had known that a shoulder ache that does not improve with stretching could be related to his breathing. The takeaway here is to look for the patterns that do not make sense. If you have shoulder pain that seems to get worse when you are tired or when you are breathing deeply rather than when you are lifting things, that is a major clue. It is those little inconsistencies that tell the real story. If you are finding these insights helpful so far, please give this video a thumbs up because it really helps us reach more people who might be sitting at home right now wondering why their shoulder or chest won't stop aching. And if you have not yet, do subscribe because we have so much more to share about how to stay ahead of these challenges. We are just getting started on this list, and your support means the world to us and to the community we are building here. Let us talk about the timing of the pain, because this is a very common part of the pattern. Does your discomfort seem to get worse at night when you are finally lying down to rest? There is a scientific reason for this, beyond just the fact that the house is quiet and you have nothing else to focus on. When we lie flat, the weight of our internal organs shifts and gravity changes how our lungs sit within the chest cavity. If there is something there that should not be, the change in position can increase the pressure on those sensitive nerves and the chest wall. Furthermore, our bodies follow a circadian rhythm that naturally increases inflammation markers in the evening. For a lot of people, this feels like a nagging, restless discomfort that makes it hard to find a comfortable sleeping position. You might find yourself propping yourself up with 3 or 4 pillows just to get some peace. While we often blame our pillows or our old bones for a bad night of sleep, a consistent pattern of chest or back pain that peaks at night is something that warrants a closer look. Imagine the relief of finally knowing why you have been tossing and turning and being able to address the root cause instead of just buying another expensive mattress topper. Another thing to watch out for is a pain that is accompanied by a very subtle change in your voice or a persistent need to clear your throat. You might think you are just developing a bit of an allergy or that the air is too dry in your home, but sometimes that chest pressure and a raspy voice go hand in hand. This happens when a tumor presses on the laryngeal nerve which runs through the chest. It is all part of that same deceptive pattern where the symptoms seem unrelated but are actually pieces of the same puzzle. It is like being a detective in your own life, and the more pieces you gather, the clearer the picture becomes. I want to pause for a second and just reassure you that while this information is serious, it is not meant to scare you into thinking every ache is a crisis. The goal is to move from a place of uncertainty to a place of power. Most of the time, an ache is just an ache, but for the few where it is something more, catching it early is the difference between a difficult journey and a successful one. You are doing the right thing by leaning in and learning this now. You are taking charge of your health in a way that many people are too afraid to do. Let us look at the duration of the pain, because this is perhaps the most important rule of thumb you can follow. We all have days where we feel a bit stiff or sore. Maybe you overdid it at the grocery store or you took a long walk in the cold air. That kind of pain usually fades after a few days of rest and care. However, the pattern we are looking for is persistent. Medical professionals often use the 3-week rule. If you have a pain in your chest, back, or shoulder that has not improved or has actually worsened over the course of 3 weeks, it is no longer just a minor strain. Think of it as a guest who has overstayed their welcome. At first, it is just a minor inconvenience, but after 21 days, you start to realize they have no intention of leaving on their own. By keeping a simple log of how you feel, you can provide your doctor with clear data, which is so much more helpful than just saying, "I have been hurting for a while." Write down when it hurts, what makes it worse, and exactly where you feel it. This kind of scientific storytelling about your own life helps doctors move past the usual diagnoses of old age and get to the heart of the matter quickly. Now let us summarize what we have learned and talk about the positive steps you can take starting today. First and foremost, remember that lung cancer pain is often a dull, persistent ache or pressure rather than a sudden, sharp stab. It often changes or catches when you breathe deeply, cough, or laugh because of the irritation to the lung lining. Do not ignore pain that shows up in unexpected places like your shoulder or between your shoulder blades, especially if it does not feel like a typical muscle pull. Be wary of pain that gets worse at night or keeps you from lying flat comfortably. And finally, use that 3-week rule as your guide for when to seek a professional opinion. The good news is that we live in a time where medical technology is incredible. For those who are at higher risk due to age or smoking history, there are things like low-dose CT scans that can see things long before they ever cause a single ache. It is like having a high-tech radar system for your body. Instead of waiting for the storm to hit, you can see it coming and steer the ship to safety. If you take away nothing else from our time together today, let it be this. You have a voice, and you have the right to be heard. If you feel something is not right in your chest, do not let anyone tell you it is just a part of getting older. You know your body better than any textbook or any 30-minute appointment could ever capture. You are the captain of your health, and you have every reason to be optimistic about your future when you are armed with the right information. I know that thinking about these things can be a bit heavy, and it is okay to feel a little overwhelmed. But please remember that you are not alone in this journey. We are all here together, learning how to take better care of ourselves so we can enjoy our families, our hobbies, and our freedom for many years to come. Every small step you take today, like watching this video and learning these signs, is a victory. You are building a stronger, more resilient version of yourself, one piece of knowledge at a time. Imagine the peace of mind you will have knowing you are being proactive rather than reactive. That is the goal of aging with grace and intelligence. Now, I would truly love to hear from you. Which of these signs surprised you the most today? Have you ever experienced a pain that turned out to be something different than you originally thought? Please share your story or any questions you have in the comments below, because I read every single one and our community learns so much from each other. Your experience might be the exact thing someone else needs to hear today to feel less alone. And if you found this video valuable, please hit the like button, because that tells the computer to show this to more seniors who might need this information. And if you have not subscribed yet, please join us so you never miss out on these science-backed insights for living your best life. If you are still with me and you are determined to stay proactive about your health type A, 1 in the comments to show your commitment. And if you have questions or doubts, type a 0, because I want to hear those too. Thank you for spending this time with me today. Stay strong, stay observant, and remember that your health is your most precious asset. Keep taking those small steps forward, because they add up to a long and beautiful journey. I will see you in the next video.